Hello and welcome to today's webinar. Bienvenue tout le monde. This first event of many is very special to us. We are extremely proud and that we are more than 100, well, actually 80 now, 80 people today, meeting this morning because we all care about making a difference in the lives of older adults living with frailty and their loved ones. Furthermore, we're all together virtually during this pandemic, despite Zoom fatigue, to further our knowledge. So thank you for joining us today. Vraiment un gros merci à tous ceux qui sont avec nous aujourd'hui. Today's webinar is presented to you by the Pearly Rideau Center of Excellence in Frailty Informed Care and the University of Ottawa Life Research Institute. The goal of the Center of Excellence in Frailty Informed Care is really about fostering innovation and evidence-based research to optimize the care and improve the quality of life of older adults living with frailty and their loved ones. It is my great honor to introduce a dear friend and mentor and an important partner in making this event happen, Dr. Linda Garcia. Dr. Garcia is the founding director of the Life Research Institute and a professor in the Interdisciplinary School of Health Sciences at the University of Ottawa. Linda Garcia's personal research interests focus on the impact of physical and social, technological, and clinical environments on the quality of life of individuals with neurological disorders, especially dementia. She's interested in developing interventions that include approaches based on human interactions, especially in long-term care living environments. Linda, thank you for your partnership and for being here today.
Merci beaucoup. Écoutez, c'est à mon tour de vous souhaiter la bienvenue et de vous remercier beaucoup d'être venu à cette conférence qui s'annonce fort intéressante. Ça fait longtemps qu'on attend. C'est un grand honneur pour moi de vous présenter le professeur Philippe Voyer. We at the U Ottawa Life Research Institute are happy to partner with Pearly Rideau Center of Excellence in Frailty Informed Care to launch this very first in their series of webinars. The goal of our institute is to bring researchers from across 10 faculties and partners with diverse perspectives together to work collaboratively to transform how we view aging and how we can create new opportunities for life fulfillment and well-being. Our 115 members want to inspire individuals to live the longest, best lives possible, honoring the many varied choices along the way. Our understanding is that Pearly Rideau Center of Excellence in Frailty Informed Care is striving to attain those exact same lofty goals, and we're very happy to team up with them to welcome Professor Philippe Voyer. Philippe Voyer, registered nurse, PhD, is a full professor responsible for continuing education at the Faculty of Nursing at Laval University. Dr. Voyer is involved in research, teaching, continued education, and clinical practice. He's the author of several books used in Quebec and Europe that have won prestigious awards, including the Minister of Education Award. He's the principal investigator who created the radar tool to detect the signs of delirium, a tool that's now available in 5 languages. Professor Voyer is well positioned to help us all reflect on transformations in long-term care. He was mandated by the Quebec Ministère de la Santé et des Services Sociaux to showcase a project that transformed traditional long-term care homes into long-term care homes for people living with Alzheimer's disease and related disorders. He contributed to the development of the Alzheimer's Plan and co-chaired the Committee on the Quebec Guidelines for the Management of Behavioral and Psychological Symptoms in Dementia. Dr. Voyer is passionate about changing our ways of looking at long-term care. He continues to advise the Ministère des Aînés et des Proches Aidants, the Ministry for Seniors and Caregivers, as they create what's called les Maisons des Aînés, homes for older adults. This project, launched in 2019, is designed to transform more than 2,500 residential and long-term care spaces into living environments better adapted to the needs of older adults. Many existing long-term care homes are to be renovated, while others will be rebuilt in keeping with the new approach to accommodation. Comme vous pouvez voir, le professeur Voyer est bien équipé pour nous parler de transformation. The future is now. As we all work diligently to transform long-term care across Canada post-pandemic, the Pearly Rideau Center of Excellence in Frailty-Informed Care and the U Ottawa Life Research Institute invite you all, take out your pens or your keyboards, take notes, and welcome Dr. Philippe Voyer. Merci.
Wow, what an introduction. Thank you very much, Linda. It's my pleasure to be with you virtually to give this presentation. And that's right, I'm very passionate about the living environment for people with Alzheimer's disease and their loved ones also. So the objective of my presentation is really to describe the characteristics of living environment that produce positive resident outcomes based on research. Also to present innovative and inspiring international living arrangement models for older adults living with cognitive impairment. And finally, to illustrate Quebec's innovative models, I will talk about two of them, one renovation project and one brand new building. So I hope it will inspire you to go in this path and even go beyond. So I have to mention potential conflict of interest. So you keep that in mind when I give my presentation. But in fact, Linda mentioned many of them because I act as consultant for public, private, and community organization. I provide advice also to the government at different level. And I write books also on the care of older adults. And sometimes I have remuneration for that, and sometimes for my book, of course, I receive royalties for my copyrights. So I'm not trying to sell you anything, but it's always important when you give presentation to mention if you have conflict of interest. Okay, so should we change our model of living arrangements for people with Alzheimer's disease? Well, I'll let you decide. I mean, if you have cognitive impairment, you have memory problems, you have disorientation, you have disorganized thinking, and you live in such an environment with long corridors where there's a mix of operation task with it's your living environment for the resident, and it really looks like a hospital. Is it really what we want to offer to a long-term care resident? If you need a bath, is it? Do you see this bathroom like very warm and welcoming? And no, it's frightening for a lot of residents. So we have to kind of review our environment for a long-term care resident, because when they enter such a room with cognitive impairment, with sight problems as well, they really don't know what to expect. So that's no wonder some of them would grab, the door and didn't want to enter this room because they would be scared, because we didn't think the design of these environment, of these rooms, thinking about the reality, the point of view, the perspective of a resident with cognitive impairment. Often when we build new nursing home, long-term care facilities, or assisted living, we'll ask questions to the nursing staff and other healthcare providers. And they will say, well, we need offices and desks, and we need a large place to have meeting. So we end up with big nursing station like this one, and it makes a separation with the residents, so they are not in there together. It's like for the resident, there's a reminder on a daily basis that, oh, you are sick, I'm the professional, I wear my uniform, I take care of you, you're the patient. So it is really the setup of a kind of a relationship that is unequal between the resident and the staff. The other thing is, for a resident that has cognitive impairment, is not aware that he has cognitive impairment. So he doesn't really understand the surroundings. So he wants often to get out of there because he doesn't feel sick, because what he sees is like a hospital. But it's pretty rare, or I would say never, that we would ask residents with cognitive impairment or family members, caregivers, what type of long-term care facility unit or you would like to have for your loved one. So are there alternatives? Okay, well, nowadays we have many alternatives. So there's no country that provide, just innovative nursing homes and long-term care facility for their residents. But in many countries now, we can find one or two centers that are very innovative that you can visit and be inspired by what you see there. And obviously, there's the well-known dementia village in the Netherlands. But in the Netherlands, I was even more impressed when I visited the Alzheimer farm in the Netherlands. You also have one in Switzerland and Italy, Austria. In Austria, I was really impressed by how they promote freedom, the sense of freedom for the resident. There's no locked door there. All doors are unlocked, and the resident, they are wearing a jewelry, a necklace with a GPS, and so they can go everywhere, even in the village. So it's a totally different mindset that you would see when you visit this Alzheimer center. In Norway, I was quite impressed by their use of technology. They go very far. They pair up with different companies, tech company, to really improve their technology, but improve their feasibility, acceptability, and usability for the nursing home and the different long-term care facility. And of course, there's the greenhouse project, which is not a project anymore because they have now more than 300 houses in the US. And in this project, they really have shown that we can do a lot in a setting that is not an hospital-like setting. And we have now in Canada, there's not only, I would talk about Quebec, of course, because this is what I know best, but we have in Saskatchewan models that are very interesting, but there are also the new Alzheimer village in BC as well. But so nowadays we have many countries that are trying to do things differently in this regard. And I want to mention models that stand out to me. And I quickly mention the greenhouse project. And the greenhouse is, what is impressive about it is how simple it is. And it provides very good result because it's really well backed up with the scientific data. And it's just they create house that are very simple in design, but it helps the resident with cognitive impairment to understand this is the dining room because it looks like a dining room, a kitchen, a living room, and so forth. So for a resident with cognitive impairment, it's very easy to understand what is expected from you because you feel like you are at home, so an environment that you understand well. The other thing that they promote is really the presence of family members. They promote nature, social interactions. There really no schedule with leisure activity. That's not the way it works there. It's really like you are in your house and you have people with mild, moderate, and severe. Often people think that they're only mild cognitive impairment resident in these greenhouse model, but that's not true. In fact, they can be there until the end of their lives. And it's just the staff, the number of staff members that they will be adjusted according to the needs of the resident there. So it's a very simple concept that provides very good quality of care. And at the same time, it keeps the resident busy. It gives them interaction, social interaction. And we know that this is very important for them in regard to the way, because these are causes of behavioral problems. I mentioned the Alzheimer farm. In fact, it's very important to have a philosophy that is clear right from the start. And when I was there, he explained to me that his vision was, if we can do it at home, we can do it here. And with this philosophy, they were able to go very far and challenge the different policies that you have by the government and different institutions that they have in the Netherlands, because they do have also these policies that we feel like obstacles to do things differently. So he had to fight as well to make things different. So in Quebec, many nursing homes and long-term care facilities and assisted living, they would say that you cannot bring your cat, you cannot bring your dog. But here, when you visit, you have dogs and cats in different households, but there's a farm in the middle of it. And it brings a lot of interaction with the resident, but also it brings a lot of volunteers, because here in this Alzheimer farm, you have 64 residents that they are there at every level of the disease, but you have 150 volunteers because they come because they are kind of attracted not only to give support to the resident, and most of them is just to work at the farm, but it creates life on the setting. The Alzheimer village in Rome, what is interesting in this one, because they kind of go a little bit beyond what I've seen in the one in the Netherlands, is they created team rooms where what they want to do is, instead of having a multifunctional room that you would do very many different activities, they create rooms so there are a smaller group of residents, 4 to 8 maybe, and they will do activities there, but the surrounding, the decoration, it communicate what it is expected for the resident to do. So it helps the worker there to do the activity, and for the resident to understand what he should do there. And you have here on your right, I don't know if you're right or left, but on my right, you have the music room again. So for the resident, as I mentioned, it helps, activate their, to stimulate them to be active. Okay, is this just an illusion, or are there real benefits for the resident? When I started to visit these type of institution and innovative model, it was in fact when I arrived at Laval University in 2000. So at the beginning, there were not so many studies. We had like this one in 2007 and so forth. So fortunately, nowadays we have many studies to back up small-scale residential model, and that they have positive impact. It has a positive impact on the functional. It reduces the functional decline. It promotes cognitive health. There's more daily activity for the resident, because since they can take part of the preparation of the meals, of the laundry, or using the broom and things like that, well, they are more busy, more involved, and they feel valued as well. This is what we see in small scale environment. There are fewer behavioral problems. If you look at studies done by CoE Mansfield, she has shown many times that the lack of interaction and boredom was the most significant and frequent causes of behavioral problems. So in these environments, because we stimulate them to be part of many activities, and activities are very simple and based on what they have done for so many years, laundry and things like that, well, we see that they are in interaction and they feel value, they are active, so there are fewer behavioral problems. There's less anxiety and negative effect. Again, because if you have cognitive problem, you are in your bedroom, you open your eyes. If you see an environment that you understand, your furniture are there, well, you feel less anxious than if you are in something that looks like a hospital bed. We have studies that have shown that it improves their quality of life. Family caregivers, they say that they prefer small-scale residential model. In fact, they say that they have control over their own daily lives. They appreciate the easy and open contact with the staff. The nursing staff as well, because for many years we put them like in a position like healthcare, providing care, and at the same time providing quality of life. It was like seen in a position, but nowadays that we know that we can provide a good environment with a home-like taste or feeling, and at the same time provide good quality of care. And in fact, nursing staff, 93% of them would not want to return to traditional nursing homes when they have work in a small-scale residential model. They have more attention, dedication, and time for resident, and also they appreciate the professional autonomy in these environments. Okay, now I turn to examples from Quebec. The first one I will present is La Maison l'Étincelle, or translated like the Spark House. In fact, this is the building that they have, and there was one unit that was a rehabilitation unit. And they wanted to turn it into an Alzheimer unit. So they contacted me and say, well, can you help us to change, to make this unit more adequate, more tailored to people with cognitive impairment. And so I went there and I looked at the unit to see if it was possible for me to help them. But looking at the literature, I knew that it was something that was worth doing, because we have studies that have shown that changing the outlook, the decoration of a unit, it can help the people with Alzheimer's disease, and it can decrease behavioral problems like agitation, aggressiveness, yelling, and wandering. So inspired by these studies and also my experience and what I've seen elsewhere, well, I started to work with them to really try to renovate this unit and make it interesting for the resident and the family member. So as you can see, this was a starting point. It's really like a unit that you would see many places in Canada in different long-term care facilities. So you have a corridor, very dull. I mean, there's nothing interesting there. You have storage closets, and again, just like a long corridor with hospital beds, hospital room. It really looks like a hospital. It was a rehabilitation unit. So you have these rooms for rehabilitation with these tools. So obviously it was not very clear from the start that, okay, what can I do there? So what I decided to give them for advice, and they decided to trust me and work in that way, was, well, we're gonna kind of borrow two concepts. First, from the greenhouse model, I wanted to make sure that the kitchen and the dining room and the living room really look like you're at home. So a home-like environment. Their apartment as well, I wanted them to be personalized as much as possible. So make sure that decoration is personalized, that they can bring their furniture and things like that. But the long corridor, then I borrowed kind of the concepts from the Alzheimer village. I wanted to create a street. So in this way, the bedroom is more like their apartment. They go in the street when they get out of their apartment. So we create these streets with grocery and trees and terrace, as you will see. So you have this street. So it helps them for orientation to place when they walk and things like that. We also had to camouflage different doors, so to avoid that they want to get out of the unit. So the first thing I did with them was really to ask them, what do you want to achieve? What is your mission, your goal? They say, well, we want to have an Alzheimer unit. We want them to be happy. Okay, that's right. Okay, so I continue to discuss with them and some of their staff, because for me, it's very important. If you say, Philippe, our vision is that we want all the residents to have their medication on time. Oh, okay. Then I'm going to make sure that the pharmacy is very close to the unit. I will make sure there's clock everywhere and reminders, but if it's not the vision, then you do things differently. You always have to have this in mind. What is the vision? So what they say is they said, well, we want to make sure that our staff try hard every day to create a spark in the eyes of the resident, so that they are happy, active, they feel, like this. So then I said, okay, then I know what you're looking for. So we have to create an environment that will support the staff in trying to achieve that. So as I mentioned, well, we had to kind of hide different doors, because we don't want to have doors that are clearly visible, but we don't want the resident to go there. So what would happen if you don't camouflage it? Well, the resident would try to get out from this door, because you want to see a door, so you want to go through. So the staff would have to ask the resident, no, you can use it, you can go, and then there's frustration, there's agitation, behavioral problems. And in fact, it's just a bad design that just provoke this type of behavior. So you have to kind of camouflage, hide everything that would disturb the daily lives of the resident. The other thing that we did, we say, well, we want to have the family members to come as often as possible to feel at home. So we created, like, here's like a house with the backyard of the house. This is the nursing station that is hidden. In fact, it's only a computer that is behind this door. And when you enter the house, well, it is a house now. It was the rehabilitation room that I shown you before, that you saw the rehabilitation tools. So now it's it's like a kitchen, a living room, a small table. So family member, they can come there and spend time with their loved ones and have their intimacy as well. So you create this type of space if you want family member to be there. The other thing that we did, we use paper paint paper on the wall, paper painting in the wall. I mixed up. Anyway, so on the wall to create the grocery, but you have to put real food also on the table so they don't try to grab the banana on the painting. So and it helps for orientation as well, and of course it removes the boredom of having these corridors that all look alike and that are not stimulating at all, and make you feel that you are in a hospital. We put on the walls memory boards to stimulate conversation between staff and resident, but also between family member and the resident. This is another door that we had to camouflage, and since this residence is in Montreal, this assisted living, what we did is really since in Montreal we have winter, in Canada we have winter, in Quebec we have very harsh winter too, and so since they spend a lot of time inside, we created this part. There's a bird cage now in this part of the unit. And as I mentioned, I wanted to create a kitchen that looked as a dining room and a kitchen as possible. So that's why we put in place furniture like that. We have curtain now here in the window. And at the other end of the corridor, we put like another paint paper on the wall and to camouflage the door there. And we use like a terrace because you can find a terrace outside, and with a table again. So this is really to avoid residents to try to enter the rooms of all other residents because there's nothing to do in the corridor. So what you do, it's really you create some atmospheres, some things interesting in the corridors. So in the corridor, there's less chance that they would enter the room of other residents. So it was to give you an example of a renovation project. This next project is Humanity, and there's only one building now built. This one, it is at full capacity now. So they are starting to build the other one this summer. So we are working right now on the architectural plan for this part. And again, this one I was having the role again to give them some advice. But right from the start, so we were able to start from scratch. So it's easier than doing a renovation. So since I was starting from scratch, and they were kind of eager to, listen to me and what are my advice and so forth. So what I decided to do is really to establish quality criteria for creating Humanity. So I ended up with 18 criteria that I follow through every step of the way to until today. It's been more than 2 years now that this long-term care facility is open. So for today, I won't talk about all these 18 criteria, but it's just to let you know that it's not only the building or the architecture or the design. There's many other things to take into account. But of course, nowadays, with what we know in regard to architecture and design, we have to take it into account. So, and I think that's We are way behind what we know and how we build buildings right now. So one thing that I'm very proud that I was able to do and make in the humanity, it's put the concept of front stage and backstage into humanity. So the backstage is everything that you have to do to operate such a long-term care facility. So you need administrative staff, you have the delivery of goods and supplies, you have the kitchen, you have the nursing staff that need office, you have the people that would take care of the cleaning team of the humanity. You put all that in the backstage. So you don't want these people to interact with the daily life of the resident and to disturb them because of their activity. For instance, you won't find an office of a nurse in a household at Humanity, because when they meet people, from the outside in a regular nursing home, they have to go through the unit, different. They would go to different floors, take the elevator, and things like that. So they will disturb many people. They may stress a lot of people just to see the nurse, the chief nurse. So what we do, it's all the administrative staff. This is the main entrance. So right on your right, you have all administrative staff and the office for the nurse and things like that. So if you are coming from outside, you don't have to go into the household to see the staff. You can see them without disturbing the lives of residents. And this is the only place that you can go from front stage to backstage. And there's not even a door, because here's the other way around when you look at the main entrance. So this is the, I don't know if you see my mouse, but I hope so. There's the same, this is the same wall. So for a resident with cognitive impairment, with the change that happens with his eye, he doesn't see that there's a door there. And so for the staff, they can move around easily, but at the same time for the resident, well, what we want to create is an environment that is so stimulating, interesting in the front stage that they don't want to go out, they don't want to go to the backstage, or they want to go to quit, to escape from this long-term care facility. So this is something that's interesting because everything is separated. The other thing, it's really based on the greenhouse model and the houses that I saw in the Netherlands, Alzheimer villages and a village like this. It's really to have these households for 12 to 15 residents. And what we did is we just go a little bit beyond. We improved things at different places in the household. For instance, the kitchen cabinet, you have like the door is a window, because we want the resident that help to set up the table, prepare the meal, to see the plates, to see the cups. So it's easier for them to interact with their environment and to help the staff. You would put a broom here instead of in a closet. So you would have residents from their own initiative that would pick it up and try to clean, start cleaning the floor. The other thing is you want to have enough information from the design and the decoration so that they know this is the kitchen, this is the dining room, and this is the living room. But at the same time, for the staff, it's open enough that they can watch, they can see all the time the residents without having to move around and see where they are and things like that. So it has to be designed like this. And the effect of having also like that is that you increase the level of interactions between residents. And this is very important. I mentioned it before, but I remind you, social interaction, fighting boredom, it's very important for people with cognitive impairment. And having these living room, it helps a lot to fight these risk factors of behavioral problems. And the other thing that is important to point out is the fact that residents in these households, they can be at mild, moderate, or severe stage. In humanity right now, we have about 25% of the residents that are the mild stage of dementia. We have, I would say 50%, something like that, at the moderate stage, and we have another 25% at the severe stage of dementia. And they all live together in their household, in their apartment with other residents, and it goes very well. We also want to have an apartment that can be personalized. So when a resident with a family member, they lease or they rent an apartment there, in fact, you only have white walls because we want the resident to bring their furniture. They all have an Italian shower, so they can have their shower in their own apartment. They don't need to get out into a room, a bathroom, where there are other residents that they go through, you know, in front of the other resident to get into the bathroom. So they all have their own shower as well. This is very important because 50% of the behavioral problems are caused and happen during hygiene care. So having a shower like this, it helps a lot to reduce the level of resistance to care. We still have a bathroom with a bath, but it's more like a spa approach. You have aromatherapy, you have music therapy. So the goal here is more relaxation, stimulation than, even though they will be washed, of course, clean, that's not the main goal, because they are washed in their room on a daily basis, but on a weekly basis, for some of them, they will have their spa time in this room. Another thing that is important when you think about residents with cognitive impairment that are institutionalized is that the fact that they are not exposed to sunlight. So that's why in every household, you have this sunroom where the resident, they go there, they can see outside, but they are exposed to the light, the sunlight. And we know that it has a scientific, clear impact documented on mood, sleep pattern, and behaviors. So when you think about creating a building adapted and tailored to this group, yeah, you have to think about it, because during the winter, they won't go outside very often. I've shown you the team rooms in Italy. So we recreate these team rooms in humanity. In fact, there are 36 team rooms in humanity. So this is their workshop room. And in fact, the goal here is really to have residents that by themselves, they are seeing their environment, they are seeing what is offered, and they can start to, in fact, they stimulate their cognitive function, their physical capacity, because we offer, the environment offered them these type of activities. This is the team room about laundry. So a resident would walk in his household and they would see these towels. They can start to fold these towels. They can hang it on the clothesline if they want. So again, it's not like everyone is there and they are active doing that. It's just most of the time they will be in the living room with others, and most of the activities are there. But when they start to wander, we don't want them to get into the room of other residents to reduce the risk of that. So that's why we have team rooms everywhere, so that they are more active in the public space, if I can say that. In the I mentioned that I was inspired by Alzheimer Village and also by the greenhouse, but this ground level space in the front stage was really a creation that we had to make, because there's no example like this. Because most of the Alzheimer villages, you would find them in France, in Rome, Italy, and even in Netherlands. They don't have snow like we do. They don't have minus 30 and 40 during the winter time. So we had to kind of create at the ground level an open space that they will have a sense of freedom. And that's what we did in the ground. So this is the store. So you would have resident that would go there and look at the clothes there, and they can pick it up, they can bring it to their room. There's no issue with that. There are jewelries there. And you know, humanity is not for everyone. You have to have families that are willing to take, even though it's not big risk, but they are to be willing to take risk. Because as you can see on the shelves here, you have jewelry. So if you are a family member saying, oh, but they can pick it up and they can swallow it, they can choke. Well, you can see risk everywhere, okay? But it has not happened yet, something like that in humanity. And we are 2 years now into this. And this is something I learned a lot when I visited these Alzheimer village, because this is a value that they share. All of these innovative models is to be able to take risk for the sake of having a better quality of life, but it's not for everyone. So you have a bar as well, a piano bar, and at the end you can see there's also a playground for kids. And because when you visit, you know, a long-term care facility in Italy, Switzerland, Belgium, France, you see residents for lunch and dinner, they have wines and they drink wine. And for me, it was the first time I saw it, I was quite impressed. I said, oh, is there something you are celebrating? They say, what are you talking about? Well, they are all drinking wine in a glass, you know. They say, we still don't understand what you're saying, because for them, it was just normal life. They drink wine all their life. Why remove that, you know? So at Humanity, there's a bar, and every Friday, in fact, there's an activity, they call it cellier. I don't know what to translate, but it's like they drink alcohol all together, and it's very popular because family member would come. In fact, it's the most popular activity. Then you have a garage in the basement. So I mentioned that we have 36 team rooms, but we have the garage and we also have the ground level. It's not like everyone would be interested in washing a car, but we have some residents that are interested. So we have to have plenty of options. So they are more active, they are busy, and then they are stimulated, and they have fewer behavioral problems. The outdoors also had to be rethink, because you don't create the backyard like for any residence. It's like for the resident with cognitive impairment. So you want to attract them outside and to make it interesting enough that they will spend time outside and even walk from one place to another. So that's why we have a fishing camp. We have there's fishes also at the end of the it's like a representation of a small lake. And you have this farm, very inspired by something I saw in Switzerland. So it will bring the attention of the resident, but also for visitors, especially kids. So they want to go see grandma because of the farm, in fact, because they want to spend time with a chicken or a goat and things like that. I was talking about taking risk. At one point, we had a volunteer that came to Humanity, said, well, you know what? I take care of bees and I'd like to put a beehive in your backyard. And I said, oh, okay. I never seen that before. I said, well, we have to push limit. We're going to do a pilot to test it, how it's going to go. And in fact, you have 10, 12 residents on a weekly basis, because the volunteer would come every week to take care of the beehive. And again, it's some resident, they would be interested in that. So now Humanity has its own honey, in fact. We have smart technology as well. If you want to promote sleep, we use camera and acoustic sensor. It's very important. So instead of having only 2 or 3 rounds during the night, we have 16 rounds for every room. And we also have rounds for every corner, in fact, at Humanity, even the basement and the backyard. So it's very efficient camera and acoustic sensors, because it's easy to see everything that goes on. And it's a way that we use to manage staff as well, because if there's something, if let's say there are 3 households that it's very quiet and everyone's sleeping, but in another one, there were 2 falls and 1 palliative care patient and things like that. Well, you want to have more staff there to help and provide care, but you want to keep the safety of the other residents. Well, with the technology, you are able to do that. Family members are prioritized, so that's why there are 6 private family rooms. They can eat at every meal of the week if they want. It's always it's only $5 a meal, and they can sleep also freely in one of the 6 private family rooms. So we want family members to be there as often as possible. The other thing, we want children to be there. So in every household, you have this kid rooms and this kid room, and with baby dolls that you can see. So the children will spend more time because they are a place to play. But at the same time, as you know, for people with Alzheimer's disease, we have residents that will pick up the baby dolls, and for them it's a baby and they take care of it as well. And if you look at the sliding door here, well, I'm going to open it, and this is the nursing station. That's it. It's just, everything is paperless with technology. So it's just to plug and recharge the battery of the iPad, the laptop, and things like that. Collaboration is very important. When you create such an environment, you don't only think about providing nursing care, you think about everything. So for instance, this is the finger foods. It's very popular in Europe. I know there are some places in Ontario, I've been told, that use finger foods, because often people with cognitive impairment, they will feed themselves, and at one point they are not able to use the fork or the spoon, and you're going to have a staff member that will feed them. Well, there's a step in between, which is finger food, where the resident will be able to feed at his own pace. And we know that it prevents denutrition, it promotes dignity and things like that. So that's why we have this put in place in humanity. The other thing that is challenging when we say that we have people at mild, moderate, and severe stage in the same environment, you say, well, there will be some household that the care will be more demanding than others. So that's why we created our own software with a tech company. So I was inspired by what I saw in Norway, because they pair up with tech company. And so we create, on a monthly basis, we can follow everything that's going on every household. And we can see when we have to increase or decrease the number of staff, or to switch one staff by another because of the type of demand that they have in this household. Continuing education is very important, and we hire staff on a continuous basis. So we really embrace, again, technology with video training, quizzes that they can do on the internet. And we do boost session with Zoom, obviously. And it's very important, because if your philosophy is so important of what you want to deliver, then you have to train them all the time, not only once. You have to repeat the message all the time, because if you want to end up with something like that, because for me, this is humanity, is a resident that, I don't know, fell asleep. He wanted to, so he lie down on the floor. For him, he was like outside. So when your staff is well trained, you understand the disease, and they know what the administrative staff expects, well, they will bring a pillow and a blanket, instead of trying to pull the resident from the floor, saying, well, you cannot stay there, it's dangerous, it's not a place to be. And there can be many problems arising from such a situation, which is, in fact, just for this resident, he wanted to sleep. So for me, this is a good philosophy in action. COVID-19 and humanity, I've been asked to mention what happened about it in humanity. In fact, when I gave my advice to this group to create humanity, I was only thinking about improving quality of life of the residents, and making a connection between the evidence that we have in science and put it in reality at humanity. So I had kind of unexpected positive effect of the design on COVID, because of course the household we have 12 to 15 residents. That is very different than 32 to 36 resident on the regular floor in nursing home in Quebec. So if there's one resident that would be infected, the spreading would be easier to control. The other thing is that for the public health authorities, they say, well, we're going to see these residents in one household like a family. So they were not stuck in their bedroom. In fact, they were able to live all together in the household. So the feeling of isolation was very limited for them. Yes, they wouldn't be able to go to the ground level, things like that. They were limited, they were restrictions. But the impact, when I compare it to some nursing home, a resident had to stay in their bedroom, it was very complicated, and the impact was negative on their behaviors and cognitive function and so forth. The fact that every household are independent. We have 2 elevators and 2 stairs that are located in a way that it was easy for the staff to access and exit every household without, cross-contamination. So this was, and the technology helped a lot as well when we wanted to see, for instance, we were waiting for the result of a test and the resident was waiting in his apartment. So instead of always opening the door and see the resident, we could use the camera to see how he was doing. And the most important and significant positive measure or design that had an impact on the spreading of COVID is the front stage and backstage. Because of this concept, we reduce extremely the level of interactions between staff that they don't need to interact with residents, the administrative staff, and the delivery of the supplies and things like that. So everything was put in the backstage, and it was really the staff that provide care that would enter the goods, the supplies into every household. So in this way, we're able to really limit the spreading of COVID-19. So we had something like 6-8 cases of COVID-19, and it was all a contamination from a staff, and the infection that the staff had came from community infection, because there were no spreading among residents. So we were able all the time to control very well the spreading of the COVID-19. And in fact, when you look at the study just released in 2001, they look at non-traditional small house nursing home, and they have shown that when they made comparison with regular long-term care facilities, and there were also fewer COVID-19 cases and deaths as well. So my conclusion is, in order to offer quality support to people living with cognitive impairment, we must meet their needs at the individual, interactional, and environmental. And I would say that for many years, we promoted the importance of staff, the importance of meeting the needs of the resident. But when we create a new building, we have to take into account what we know now, because I can see the difference. When you have an environment that doesn't cause frustration among residents, it helps the staff a lot. So thank you very much for your attention. And now we are open for questions. And I will stop sharing my screen.
Thank you so much, Dr. Voyer. This was such an excellent presentation, so inspiring. I think it's so important that we start changing our attitudes about living arrangements for older adults living with dementia. And so this is, it fits exactly with my, current views. And so thank you for
Great.
this.
Well, you're welcome.
So inspiring, yeah. We do have a few questions, but we are limited in time. So I don't know, do we, maybe I can ask you one question and see how it goes. And then I think what we can do for all our attendees is maybe forward the questions to you, and we can see if we can send some of the answers. I think one of the major questions that arose was really about the cost of the home and how does it compare compared to more of the traditional setting. So that's
a very good question, in fact, because I have received funding from the government to study that, in fact, to compare 4 innovative models to the quality of care, the impact of the residents, so forth, but also on the cost of it. And in fact, you really have to think about I would talk like the product humanity, not what the resident have to pay. Okay, this is different, because when you look at in the public sector, we have a cap that they have to pay a maximum of 1,800. But this doesn't cover the cost of long-term care facility in Quebec. Okay, so when you take into account all the costs for a resident in a regular nursing home, just for the operation in Quebec, it's around $8,000 a month. Okay. When we talk about Maison des Aînés, what we are building right now, it's going to be higher than this because it's smaller. The units are smaller. When you have a smaller unit, you know, the costs increase, and also the cost of the building increase as well. When you look at humanity, in fact, we have 170 residents, and the cost of the product, when you include everything, it's 6,500. So when people say, because the resident have to pay because it's private, people say, oh, it's too expensive. And I respond to that. Well, in fact, if the government was to do exactly the same thing, they will save money, in fact. Okay. And the other thing that is very different, and I don't have the explanation for that, but I work with the government, but I can see that there are so many steps to create something which is very different than the private. But for instance, this building, Humanity, with 170 places, it costs something like $250,000 a door. That's the way they do the math in this industry. When you look at a nursing home, a regular nursing home built by the government, it's $400,000 a door. When you look at Maison des Aînés, the brand new one, it's going to be $700,000 a door. So the issue is really not the money that the government is prepared to invest, it's the efficiency of the system. But I'm not an expert in this regard, but I know that the cost is totally different. But the cost is not a barrier if we do things differently.
Thank you. I'm going to try to squeeze in one more question or two, if you have some time. Another one that was mentioned is really, what is the staff to resident ratio? What's the optimal number of residents that you see in those, more innovative living arrangements?
Yeah. Well, this is something, for me, Humanity is really a lab, okay? Because these owners of this long-term care facility, they really want to make a difference, okay? They have many other buildings and things like that. So for them also, they want to make a difference for these residents. So they are very open to many suggestions that I make. And for many years, I was saying, well, instead of having a resident with mild cognitive impairment that is in assisted living, to move in to another resident when he's moderate, so he is in the intermediate residence, what we call it in Quebec. And when they reach the severe stage, we put it in the nursing home. So they have 3 transitions. So I challenge the government and administrators in the public health sector to do things differently, to say, well, what we should do, the resident should have his apartment, and then you adjust the staff surrounding the resident so the resident don't move, because we know that there is a great impact on the resident when we move it. But I've been told it's impossible to do that. But now it's been 2 years that I do that at Humanity, and we're going to do it in the Maison des Aînés. I was able to convince and to demonstrate that. So you've seen the graph with all the lines. So in fact, to answer the question, there's no specific ratio. We have household where you can have like 2 staff for 14 residents, and other also that we have 4 staff for 14 residents. Okay, because I adjust on a monthly basis the staff surround in each household to provide the care.
Thank you. one last question, I think.
No
Is that
problem.
okay with
No
you?
problem.
Yeah, absolutely.
If you
okay.
have time and the participant have time.
There's still quite a few participants online, so I'm assuming
I can be there until 11:15.
Okay,
so it's
wow,
fine for
thank
me.
you. Well, one of the other things that was really, one of the other questions was really about, how do you convince, the government? How do you push towards those changes? How do you, what are some of the obstacles that you had to go through and how did you,
Yeah. Well, this is it's a great question, and I know the presentation is recorded, and it's in English, so I have to really find the right word because I would say that it's very difficult to convince the government and the authorities and the architects and working for the government, because it's like saying, well, for the past 20 years, we have the data to say we should do things differently, but they didn't change it. They are more the mindset of keeping the statu quo. So when you arrive and say, well, we need to do things differently, they will say, I'm not sure it's going to work here. We have the unions. They will say many reasons. And what was really a game changer for me was humanity, because it was private. So I was able to showcase, because I've been told before, doing a building with households like this, no, it's not really possible, Philippe, to do that by very important people. And then I brought the Ministry of Health to visit humanity. It was like they were scratching their head. Okay, now, so it helps a lot to create Maison des Aînés as well, because they saw it. The Ministry of Seniors, they went to the opening of humanity and she was on stage and she said, thank you very much. I hope you won't have concern. We want to copy you. Okay. So for me, it was really the fact that they had it in their face that we can do. Was the most powerful thing to make a change in the landscape of long-term care in the province. It's not one yet, but you cannot avoid it anymore. It's pretty clear that there's another way to do it. And it's just because when I was showing different models internationally, they would say, well, in Rome, it's not the same thing. In Italy, in Norway, neither, and so forth. So there's always a good reason not to move. But so there were no like a golden argument that I gave to a Ministry of Health and I say, okay, we're going to do that. It's when they saw it, they visited, they walk into humanity, then there was no coming back.
Yeah, thanks. All right, so another question that we have is, how do you adapt activities and services to the different levels of, functional limitations? And so, for example, you have mild, moderate, and severe cognitive impairment all in the same living together. And so how is that adapted?
Well, there's many aspects to mention about it, because the first thing we do is to make sure that people that are the residents that are in one household, they share the same value, interest, and passion. So when they want to be admitted to humanity, there's really interviews that are made and to understand the person. So you make sure that there's good connections between residents in each household. So if they love hockey, so Saturday night they will watch hockey. It doesn't matter which stage of the disease they are. It's just that the atmosphere, the feeling, what they see, what they hear makes sense for them. So this is one way. The other thing is we have 2 regular leisure activities that people dancing, singing, music, and painting, things like that. But we have also clubs. Clubs is really borrowed from the Netherlands. So you have clubs like we have these scientific clubs. We have a lot of nurses and physicians living in humanity. So they have like chips and Coke, and they're gonna watch a surgery with, on the screen. They have their own activity. We have the other one that love hunting and fishing, and they have their own activity. So you have to create many activities, many opportunities, and not looking for the home run activity that everybody wants to do, because it's not possible anymore. We put a limit of about 40 residents for an activity because it's too noisy. It's too disturbing to them. So you really have to change the way you do activities in such an environment.
Thank you. I find this so inspiring how, how you've managed to make so many changes despite, the obstacles that we all face. So thank you. I want to give Dr. Garcia a last chance to say some final words. So Linda.
Thank you. Thank you very much. Thank you very much, Philippe, for this wonderful talk. They're off the charts in terms of questions and answers, so we're taking note of them, and we'll get back to people as soon as we can. Keep everybody in the loop. There's a couple of things I think that really struck with me, and I think some of the things is about attitudes and looking at, rooms that communicate something, rooms that communicate this is where you do X, Y, Z. And I'm, I have permission to divulge the fact that my brother-in-law lives in Humanité, and I can see this firsthand, how, I'm really surprised to see the interaction of the residents there. And I think there's a lot of people in this city and elsewhere who are doing great things and moving in this direction. It just feels good to have a feel-good story for long-term care these days. So I think the future is now. I think it is that you've given us tons of ideas. I think there's lots of common things that we can put into practice. It doesn't have to be a whole Humanité or anything else. I think we can look at those. We'll be picking your brain again as we move forward. Annie and I and others in the city. I know a lot of people are saying, we do this and that'd be great and that's wonderful. And I think there's lots of great ideas. So thank you for this very stimulating, very feel-good story. And I guess my call out, my shout out is to everyone here in the city and elsewhere. The future is now. Thank you, Philippe, for making us move forward on this very, very, very important issue.
You're
and
welcome.
Thank you, the
Welcome.
Center of
Merci de
Excellence.
l'invitation. C'est un plaisir.
Merci beaucoup.
Thanks again to everyone for attending this webinar series. Thanks again, Philippe. And there will be a quick survey at the end if you would like to comment on the webinar. That will only take a few minutes to complete. So thanks again, everyone.